guys, welcome back to my channel. So today let's talk about the ulnar bone. The ulnar bone is the medial bone of the forearm. It is homologous to the fibula of the lower limb. This bone has an upper end, a lower end, and a shaft. Now let's talk about the side determination of this bone. How do we know if this ulnar bone is the left ulnar bone or the right ulnar bone? First of all, the upper end is hook-like with its concavity facing forward. Now, the lateral border of this shaft is sharp and crest-like. It is also known as the interosseous border. And then it has a pointed styloid process at the lower end, which lies posterior medial to the rounded head of the ulna. Okay, so when you are placing this bone, always place the styloid process posterior medially, the lateral border laterally, and the head of the ulnar bone to always face forward. So this is the left ulnar bone. So let's talk about the features of this bone. The ulnar bone presents an upper end, a lower end, and a shaft. Let's talk about the upper end. The upper end presents the olecranon process, the coronoid process, the trochlear notch, and the radial notch. Let's talk about the olecranon process. The olecranon process projects upwards from the shaft. So this is the olecranon process. And it has 5 surfaces. It has the superior surface, the anterior surface, the medial surface, the lateral surface, and the posterior surface. So the anterior surface is articular and forms the upper part of the trochlear notch. The posterior surface forms a triangular subcutaneous area which is separated from the skin by a bursa. Inferiorly, it continues with the posterior border of the shaft of the ulna. Its upper part forms the point of the elbow. So the medial surface is continuous inferiorly with the medial surface of the shaft of the ulnar bone. The lateral surface is smooth and continuous as the posterior surface of the shaft. The superior surface in its posterior part shows a roughened area, as you can see. Let's talk about the coronoid process. The coronoid process projects forward from the shaft just below the olecranon process. It has 4 surfaces. It has the superior surface, the anterior surface, the medial surface, and the lateral surface. The superior surface forms the lower part of the trochlear notch. The anterior surface is triangular and rough in its lower corner and forms the ulnar tuberosity. The upper part of its lateral surface is being marked by a radial notch for the head of the radius. The annular ligament is attached to the anterior and the posterior margins of this notch. Below the notch is a depression to accommodate the radial tuberosity. It is limited posteriorly by a ridge called the supinator crest. Now the medial surface is continuous with the medial surface of the shaft. Let's talk about the trochlear notch. The trochlear notch forms an articular surface that articulates with the trochlea of the humerus to form the elbow joint. Now let's talk about the radial notch. The radial notch articulates with the head of the radius to form the superior radio-ulnar joint. The shaft has 3 borders and 3 surfaces. It has the interosseous border or the lateral border, which is the sharpest border, and it is sharp in its middle to fourth. Inferiorly, it can be traced to the lateral side of the head. Superiorly, it is continuous with the supinator crest. Now let's talk about the anterior border. The anterior border is thick and rounded. It begins above on the medial side of the ulnar tuberosity, passes backwards in its lower one-third, and terminates at the medial side of the styloid process. So let's talk about the posterior border. The posterior border is subcutaneous. It begins above at the apex of the triangular subcutaneous area at the back of the olecranon process and terminates at the base of the styloid process. So this is the posterior border, this is the anterior border, and this is the lateral or the interosseous border, which is the sharpest border. So let's talk about the surfaces. The anterior surface lies between the anterior border and the lateral border. So this is the anterior surface. Now this anterior surface presents a nutrient foramen where nutrient enters into the bone through the what? Foramen. Now let's talk about the medial surface. The medial surface lies between the anterior border and the posterior border. So this is the medial surface. Now let's talk about the posterior surface. The posterior surface lies between the posterior border and the interosseous border. So this is the posterior surface. It is subdivided into three areas by two lines, okay? So let's talk about the lower end of the ulnar bone. The lower end is made up of the head and the styloid process. The head articulates with the ulnar notch of the radius to form the inferior radio-ulnar joint. Now this head is separated from the wrist joint by an articular disc. The ulnar artery and the ulnar nerve lies on the anterior aspect of the head of the ulna. The styloid process projects downwards, as you can see, from posteromedial side of the lower end of the ulna. Posteriorly, between the head of the styloid process, there is a groove for the tendon of the extensor carpi ulnaris. So let's talk about the muscular attachment of the ulnar bone. Wherever you see blue, it means it's insert. Then wherever you see red, it means that muscle originates from that place. So the first we are having is the triceps brachii. So the triceps brachii is inserted into the rough posterior part of the superior surface of the olecranon process. The next is the brachialis. The brachialis is inserted into the anterior surface of the coronoid process, including the ulnar tuberosity. Then the next muscle is the supinator muscle. This muscle originates from the supinator crest, and as it originates, it forms a triangular area in front of the crest. So the next muscle we are having is the flexor digitorum superficialis. That is the ulnar head of the flexor digitorum superficialis. So it originates from the tubercle at the upper end of the medial margin of the coronoid process. So we are having the ulnar head of the pronator teres muscle, which originates from the medial margin of the coronoid process. Then the next is the flexor digitorum profundus. This muscle arises from the upper 3/4 of the anterior and the medial surface of the shaft. Okay, so it also originates from the coronoid, that's the medial surface of the coronoid and the olecranon process as well, and then the posterior border of the shaft through an aponeurosis that can give rise to the origin of the flexor carpi ulnaris and the extensor carpi ulnaris. So let's go back to the next muscle, which is the pronator quadratus. So this muscle originates from the oblique ridge on the lower parts of the anterior surface. So the next muscle is the flexor carpi ulnaris, which originates from the medial side of the olecranon process and from the posterior border. So let's talk about the extensor carpi ulnaris. that originates from the posterior border. Then finally, for the insertion, we are having the anconis muscle, which is inserted into the lateral aspect of the olecranon process and also the upper 1/4 of the posterior surface. Now let's talk about the origins of the abductor pollicis longus and the extensor pollicis longus, as well as the extensor indicis. So these muscles are originating from the lateral part of the posterior surface. So the lateral part of the posterior surface gives origin from above downwards to these muscles that I just mentioned. Then the interosseous membrane is being attached to the interosseous border of this bone. Then the oblique cord is attached around the ulnar tuberosity, okay? So it's attached to the ulnar tuberosity, while the capsular ligament of the elbow joint is attached to the margins of the trochlear notch, and that is the coronoid and the olecranon process. So here is a mnemonics to remember the muscular attachment for the ulnar bone. So on the olecranon process, at the superior surface, the tricep muscle inserts here. When you see the blue color, it means it inserts. When you see the red color, it means it originates. Then the lemon color is for the ligaments. At the medial surface, the flexor digitorum profundus and the flexor carpi ulnaris originate from the medial surface of the olecranon process. Then on the lateral surface, the anconis muscle is inserting there. On the coronoid process, at the anterior surface, the brachialis muscle inserts there. Then this brachialis muscle, after inserting there, it runs down to insert towards the ulnar tuberosity, okay? And at that point, you will see the oblique cord. Now, the medial margin, on the medial margin, the flexor digitorum superficialis and the pronator teres muscle originate from the medial margin. Then from the medial surface, the flexor digitorum profundus originates from the medial surface. Then on the supinator crest of the ulnar bone, the supinator muscle originates from the supinator crest. And on the radial notch, we can have the annular ligament attaches on the radial notch. So this is all for the muscular attachment for the ulnar bone. So let's talk about the ossification of this bone. So let's talk about the ossification of the ulnar bone. The shaft of the ulna ossifies from a primary center, which appears during the 8th week of development. Now, the lower end ossifies from a secondary center, which appears during the 1st year and fuses with the shaft at the 20th year. Now, the lower end refers to the growing end of the bone, while the upper end or the head ossifies from a secondary center, which appears during the 4th year and fuses with the shaft at about the 18th year.